The clinical and pathological characteristics of LBD clinical subtypes have been investigated in the noradrenergic and serotonergic systems, and their associations to clinical presentations have been determined. The noradrenergic and serotonergic systems project across the brain to regions such as the hippocampus, thalamus, cingulate, and frontal cortices. The Papez circuit, located within the limbic system, is a looped neuronal pathway in the subcortical region of the brain. It involves projections between the hippocampus, mammillary bodies, anterior thalamus, and cingulate cortex, and is innervated by the noradrenergic and serotonergic systems. LBD phenotypes could be differentiated in the hippocampus, as this region seems to be more severely affected in DLB than PDD, due to the significant alpha-synuclein deposition between the CA1 and CA4 subfields in DLB. Hippocampal Lewy pathology correlated with the onset of REM sleep behavior disorder and sleep disturbances. In comparison, Alzheimer's type pathology, namely amyloid beta plaques, was most predominant in the CA1 subfield and subiculum regions of the hippocampus in DLB, contributing to hallucinations and memory problems. In the thalamus, alpha-synuclein pathology was more predominant in DLB patients, as well as those with REM sleep behavior disorder and memory problems. Thalamic alpha-synuclein and amyloid beta plaques contributed to hallucinations, indicating a potential synergistic relationship between these protein pathologies to promote the onset of hallucinations, which is in contrast from their behavior in the hippocampus. Cortical pathology was predominant in the cingulate cortex than the frontal cortex, where we propose that a synergistic relationship between alpha-synuclein and amyloid beta plaques contributes to hallucinations, similarly to the thalamus, but also deposition of alpha-synuclein and tau simultaneously promotes memory problems. Therefore, these findings highlight the sheer complexity of pathological characteristics of LBDs and a potential role of the Papez circuit components in LBD's pathophysiology. The hippocampus, thalamus, and cingulate cortex are most severely affected by proteinopathies, particularly alpha-synuclein deposition, which may correlate with the onset of non-motor symptoms in LBDs. Hence, the Papez circuit could help distinguish between the two LBD phenotypes and prove to be ideal targets for biomarkers or therapeutic interventions.